Hello everyone, this is Chef Rahul Bhalekar from AISSMS College of Hotel Management and Catering Technology, Pune. I work in the food production department as an assistant professor. In this video, we are going to discuss personal hygiene, which is a part of food and kitchen safety. So let's see what is personal hygiene. Personal hygiene means to take care of himself or herself in regards to the personal health. As you see in the photograph, the personal hygiene care and the body parts which we are supposed to keep hygienic. Most of the time we use our hands while processing the food, and the other body parts that we need to cover is our hair, and we have to take care of our fingers and our skin as well. So let's look at the general personal hygiene which is been taken care by the food handler, rather supposed to be taken care by the food handler. Food handlers should wear a proper clean, neat uniform, because the dirty and untidy uniform will harbor the harmful bacteria. Food handlers should bathe daily because they need to keep themselves hygienic, their skin hygienic, and at the same time it will give you a very clean and neat look as well. The hair should be restrained by either a hat or hairnet to reduce the possibility of contaminating the food. Fingernails should be short, clean and without nail polish, as the longer fingernails will accumulate the dirt in them and will harbor the bacteria. Also, the nail polish, when it becomes old, can get peeled off and can contaminate the food. The other general personal hygiene would include that you should not keep the sores, cuts and burrs open while you are handling the food. You should always cover it with an antiseptic waterproof bandage. A complete physical examination is always recommended so that it is ensured that there is no communicable disease with the food handler, or he is carrying the communicable disease. Smoking or chewing of tobacco products should not be allowed in the entire food production and food service areas. That means right from the receiving of the raw material till the service of cooked product, in that entire process nobody should be allowed to consume the tobacco products. Let's look at the points to remember. First is hand washing, then the jewellery that you have to remember, smoking, nose and mouth, cuts and boils and septic spot due to the accidents or the injury, reporting of illness, wearing protective clothing. Now these are the points, the highlighted points which needs to be remembered when considering the personal hygiene in the kitchen. Now let's discuss them in detail. You should wash your hands when? Before entering in the kitchen, after using toilet, handling raw meat, poultry, vegetables and eggs, because all of these in the raw form they carry bacteria which are harmful. Handling waste food or refuse. all the refused food or the waste food is already spoiled and which contains the harmful bacteria which could be transferred to your hands. Another points when you should wash your hands is when you cough into your hands or when you use your handkerchief to uh, wipe out your sweat, wipe out your hands when you have handled something. Okay. Smoking, eating, combing of hair, because while you smoke, you eat, you tend to touch your lips and you might get the bacteria onto your hands and then to the food. Same with the combing of hair, you will touch your hair which also has harmful bacteria which could be transmitted. Carrying out any cleaning task. You clean the dirty surfaces, dirty vessels or equipments. At that time you will have the harmful bacteria with them or on them, and those could be transferred to your hands. Jewellery. Now you are not supposed to wear any kind of jewellery apart from the wedding ring or wedding band, which is globally accepted that a food handler can wear a wedding ring or a wedding band, because the skin under the jewellery tends to harbor bacteria, because after you wash your hands or maybe you use your fingertips to marinate something, and that could get accumulated under the jewellery and will stay there with the skin, and that damp skin can harbor the harmful bacteria. If it is been not dried properly, it stays damp, which harbors the bacteria, rather which encourages the growth of harmful bacteria. There is also a danger that you might have the chipped pieces of stones or the metal of the jewellery, and which could drop in the food and it could get physically contaminated. Smoking. It is illegal to smoke in the commercial kitchen or while handling the food by the law all over the world. People touch their lips while smoking and may transfer harmful bacteria on their hands and so to the food, because normally the smokers, they tend to forget of washing the hands, so this might lead to the food contamination with the touch of the skin, rather our lips. It also gives the ash, and if you are smoking in and around of the kitchen, the ash might fly and get into the food. Your nose and your mouth. Naturally, we tend to touch our nose and mouth when we are sneezing, when we are coughing, or maybe some other when you are stressed. That time, if you are feeling any pressure, that time you tend to touch your nose and mouth. Now, Staphylococcus aureus are carried in the nose and throat of the healthy individual, which are dangerous for the food, which can cause food contamination and food poisoning. So care must be taken not to cough or sneeze over the food or working surface. In fact, in and around of the cooking or processing of the food, you should always take a tissue paper and cough or sneeze and throw it away and wash your hands immediately. Food handler who are having the cough or cold, they are not supposed to work with the food, rather they are not supposed to handle the food in any of the food processing point. So they are supposed to take a leave, or they are supposed to ask to stop, or you can give them any other job, but not the food. It is better to use disposable tissues which are destroyed after one use. So, and those are supposed to be disposed of in a covered dustbin so that you don't have the papers flying all over. Cuts, boils, and septic spots. Any cut or sore must be covered with a colored waterproof dressing immediately, or it will get infected. You have to wash the cut or sore and dry it out with a tissue paper or with the clean cloth napkin, and put a waterproof dressing immediately. A blue or other dark colored plaster should be used instead of the skin color one, because if it gets fall, or it gets fallen into the food, you can easily identify, because blue is the color normally followed by all the kitchen professionals and the hotels, because there is no other food which has a blue color. So if it falls in the food, you can easily detect the color. Reporting illness. If a food handler is sick, then he or she should report it to his or her supervisor. The immediate supervisor needs to get the information about your illness as soon as possible. When the symptoms are like vomiting or diarrhea, if it is repeatedly or more than once, you need to inform your supervisor. Food handlers who have just returned from overseas and suffering from vomiting and diarrhea, may be any cause, but then if these two symptoms are visible, rather are felt, the vomiting and diarrhea, the employee, rather the food handler, is supposed to inform that illness to his or her immediate supervisor. Food handlers with any kind of infection should get the medical clearance before joining the work. If you have any kind of infection or any kind of irregularity with your health, you should produce an certificate of a medical officer which gives you the clearance for handling the food, so that you can join the work. Care of your own health and safety. You should be taking your own care for your own health and your own safety. That means your personal health and personal safety. The points that you need to take care is: keep a healthy frame of mind. Always think positive and always keep your health updated. Take precautions. Never cut corners. That means never ever opt for the shortcuts for doing any kind of job, because that will not give you a proper output. You will be in hurry and you will tend to face the accidents which will give you cuts. Follow hotel safety policy. Each organization forms a safety policy according to its operations and the moment of its operation. So always stick to the safety policy of your own hotel or your own organization. Beware of hazards. In your work area, there would be symbols or signs posted or placed next to the hazardous things or hazardous equipments. or hazardous area. Read them, keep them in mind, and always be careful while while going from that area or using that particular equipment. Report your health problems as soon as possible, because then your supervisor or your senior could arrange the work and could ask you to take a leave, or can direct you to the medical officer of the company. Report any unsafe conditions in your work area. If you think that the conditions in particular area or with the equipment is unsafe, please report it to your supervisor so that he can take appropriate action. Thank you very much for watching this video. Hope you would have liked it.